Good morning, everybody, and welcome to the luminary lectures that the admin is really keen on pushing. And we fondly remember all our seniors, our teachers, and all of you who are here. And I am Dr. Deepak Selvaraj, and I'm the associate director of the Ranipet campus. And I am also a proud student of pathology from my MBBS days. We've kind of looked at awe at this department as such. You know, there are people, the doyens in this department are unprecedented, and we are aware of that. I've had the honor to be a student of people like Date, Sushil Chandy, Hemalata Krishnasamy, Bhanumati, and a lot of people who we grew up with. And when we were medical students, we were really in awe of this department, and it still continues to push the boundaries. And I want to say a little bit about how we actually, as a student, we grew up so much close to this department because of Dos uncle and Annie auntie. Deepan was my classmate, and his parents were in pathology, and we were all like big fans of Dos uncle, and the stories that he used to just look at the slide in 10 minutes and tell you the whole details of that patient. And we just grew up in these stories. I'm sure they are true as well. And of course, Annie auntie was also the source of, she mentored us a lot. And we learned a lot of life and character from these two couples. And also I want to mention Dr. Sushil Chandy, who was there when we were students. Of course, the next generation is here, sitting here, and who they're going to Sheila Nair, Joyce, and Susy Kurian. They will be talking to you today, and they were also our teachers, and I'm really proud to stand here today. And the admin is really keen on pushing. Now it's all becoming molecular and cancer pathologies, molecular biology, and we are really looking at different ways of investing in equipments, HR, so just to take you all to the next level of pathology. But we all stand on the shoulders of these people who are here, and from the luminary lectures are here because we are 110 years of this campus, and we want to remind ourselves where we came from, and the people who have really helped us in where we are now. So I would like to hand over this to Meera to take this forward.
Good morning, all of you. It's my proud privilege today to stand here to welcome Dr. Sheila Nair, Dr. Joyce, and Dr. Susy Kurian, my teachers when I was a postgraduate, to tell you the story of pathology, what it was like, and what we have reached so far.
Ladies and gentlemen, I can see some very familiar student out there. Nice. We have indeed been privileged to have been part of this great CMC story, all of us. The institution has been wise to hold this series of lectures. Medical education, as we all know, started about 105 years ago, and this campus is already 100 years old. It is good to remind ourselves of our very rich heritage. As the saying goes, much has been given to us and much is expected of us. And I think we always reminded ourselves of that as we were part of this great department. Thank you, Dr. Ebby, for organizing this series and on behalf of this institution. And thank you, Dr. Meera, for giving us the opportunity to speak this morning. I will start by speaking of the beginnings of the Department of Pathology. This will be followed by Dr. Sheila Nair, who will continue with the many innovations which happened while she was the head of the department. And Dr. Joyce Ponnaiya, our previous director, will speak about the aspects of the department which have contributed to its growth and development, the other aspects. Then finally, Dr. Meera will finally speak about the present department, its innovations, and the challenges of a department located on 2 campuses, and that must be great. Thank you, Dr. Sheila, for having made my slides for me, because I'm not as savvy as she is. Okay, starting with the first slide, Dr. Ida Sophia Scudder. A very familiar picture to everybody sitting over here and to the new PG students who are sitting out there. The words that come to mind are vision, dynamism, integrity, tenacity, struggle, crisis, and hard work. But underlying all of this was her very deep faith in God. And she believed that she was building the kingdom of God. And I think that's something that we all need to take away as we sit over here as the heirs of what she started. I was so happy to recently hear a podcast on the healthcare of India. And I was told that Tamil Nadu leads in being the best healthcare provider in this entire country, both by the government sector as well as by the private, and Christian Medical College Vellore was also mentioned. Medical education started in 1918, as we all know, when Dr. Ansu put up that big poster in 2018, but it offered only the LMP course, and that was a diploma course. It trained only sub-assistant surgeons who had to work under supervision. This proved very inefficient for the government of India. So in 1940, with the stroke of a pen, the Vice Chancellor of the then Madras University canceled the course, and CMC was required to raise its standards to the degree level or close its doors. Dr. Scudder wrote in her diary, which I happened to read when I served with Dr. Joyce in the directorate during the Centenary year. She wrote in her diary, "Never before have I faced such dark times." But she hung on to her strong faith and worked hard to raise the level of the college, and all departments needed to be upgraded. In October 1943, 25 medical students were admitted to the MBBS course. In 1940, Dr. Scudder requested Dr. Ted Galt, Dr. Edward Galt, Australian, who was then working in a mission hospital in Azamgarh, a hospital that was founded by his sister, Adelaide Galt. In 1943, Dr. Galt went back to Melbourne, Australia, to train with Professor Peter McCullum, from whom he received both macro and micro specimens, including his own specimen of acute appendicitis, to take back to Vellore in order to set up an efficient teaching department of pathology. The MD pathology course was started in 1956. Here is Dr. Galt looking at specimens in the museum, familiar to most of us in pathology, which he started. The devoted Dr. Edna Galt, that is his wife, worked with Dr. Galt in the afternoons to set up the pathology museum, which we know in pathology is a huge teaching aid around which we try and enthuse medical students about pathology. I think Dr. Mari would agree with me. In 1962, at the age of 60, Dr. Galt desired to return to Australia. He was then the president of the Indian Association of Pathologists and Microbiologists. The Norman Institute of Pathology, which was established in 1959, moving from where the present directorate is to the OPD building, top floor, fourth floor. Dr. Galt, on his furloughs in Australia, spent talking about Vellore and raising funds, and that was a big thing in those days, raising funds for beloved CMC Vellore. Dr. Galt got the Jean and Howard Norman of the Norman Brothers printers and publishers in Melbourne to set up a trust to provide 45,000 Australian pounds, the equivalent of a Usher grant of today. And they were so we were the recipients. Part of that grant came to pathology because of Dr. Galt, and that is why it was called the Norman Institute of Pathology, if people around here didn't know why it was called that. And this was the inauguration in the year 1959, the year before Dr. Galt left. And this is the person standing in the front is Dr. Hilda Lazarus in her sari, who was the director at that time. This is the picture of actually Dr. Galt and Dr. C.K. Job, to whom he handed over. And in the background is that Mr. Norman's picture. So that inauguration of the Department of the Norman Institute was actually witnessed by Lakshmi Swami Mudaliar. He must have been a vice chancellor for many years, I would think. Anyway, so when Dr. Job left, when Dr. Galt left in the year 1960, Dr. C.K. Job, who was just the associate professor, took on the headship of the department while he was still working in the SLRTC Karigiri doing administration and research. In fact, in the 1960s and 70s, while we were undergraduates and postgraduates here, all of us here, the department was considered the best teaching department in the hospital. Dr. Job evolved a very structured UG teaching program, which I think even the juniors know, a lecture in the morning, micro and gross practicals on the same topic in the afternoon, followed by a short test which was based on the previous class, and that was the attendance. So no attendance was taken by pathology. Dr. C.K. Job's story in CMC is very fascinating. After school, after he even got a BSc degree, he didn't gain admission to any medical college. In 1947, when CMC opened its doors to men students, despite a lot of opposition that Dr. Scudder faced from her donors because they wanted their money to go towards a college for women. But Dr. Scudder had the vision to know that she had to open her doors to men, and there had to be men faculty as well as men students. Despite all of this opposition from them, Dr. Job was then admitted to the first class of men students in the year 1947. And I must say that when I used to introduce Dr. Job, I used to quip saying, when India gained its independence, the women of CMC lost their independence because he was the first batch of men. He did his post-graduation in pathology, and even as a postgraduate trainee, his keen eye for pathology was obvious when he discovered microfilaria in pulmonary capillaries and so discovered the cause of tropical eosinophilia. He was only a postgraduate student. His deep research into leprosy, because he was in the SLRTC as well, at the electron microscope level, and collaboration with Dr. Paul Brand is legendary. I think legendary for all of us who've read his books. In 1964, the leprosy mission financed the first EM in the country, and that was located in CMC. And I still remember it was at the basement of the OPD block. And it was used not only by Dr. Job, but also by Dr. Anand Date and Dr. Minnie Martin for their parts of their research. And Dr. Job writes in his book, his memoirs, written 2 years before his death, that the M. leprae entered, I'm talking to the pathologist now, the M. leprae entered Schwann cells, the special cells responsible for the maintenance of nerve function, and it was proof beyond doubt that this was its mode of entry. It was this direct effect of M. leprae which resulted in nerve damage, first of sensory nerves and then of motor nerves, explaining the pathogenesis of nerve destruction in leprosy. Dr. Job maintained in his memoirs that this understanding of the pathogenesis of leprosy was in fact his most important contribution to leprosy research. Dr. Job, as the head of the department, was very dynamic, and he asked the administration, I want 4 professors' posts and 4 associate professors, which Dr. Jacob Chandy at that time granted. So he had the specialties in pathology even under his headship. Neuropathology under Dr. Sushil Chandy, GI pathology, Dr. Minnie Martin, cardiac pathology, Dr. Bhaktavijayam, renal pathology, Dr. Anand Date, skin pathology, both Dr. Job and Dr. Bhaktavijayam, liver pathology, Dr. Das Sudarshanam, and gynec pathology, Dr. Adolf Walter, as well as Dr. Hemlata Krishnasamy. Pathology was undoubtedly an excellent teaching department, as we all know. And lastly, I want to speak about Dr. Minnie Martin. She was also a visionary for this department. In 1981, she granted me a fellowship to study immunochemistry at the Royal Postgraduate Medical School at London in order to bring back that speciality to Vellore. So we started the immunohistochemistry at the bench in 1985 And later, Dr. Sheila Nair will tell you, among all her dynamic contributions, how she took the IHC forward with automation as it is practiced today in the department. Dr. MM was also instrumental in introducing FNAC. When she was in Australia, she sent Dr. Swanti Orell, the author of the book, here to teach us the technique. And it was Dr. Noel Walter who took it forward from there. In 1998, when Joyce was the director, there was a huge ASHA grant for the PACS system in radiology, $600,000 US, a huge grant. And that meant that there was a radiology monitor at every clinician's desk. So in the year 2005, pathology requested the administration, that is Dr. George Chandy, to put pathology reports online. And so we migrated to the Oracle system, and then clinicians could see our reports as soon as we released them. With this, I'd like to conclude this lecture and this part of my lecture. And I would now like to hand this over to Dr. Sheila Nair to continue this great story of our department. Thank you.
A very good morning to all of you, all the administrative staff, the faculty of pathology department, and everyone else who's here. With due reverence to our founder, Dr. Ida Scudder, I feel honored to stand here and talk about the history and progress of pathology department. And I must thank Dr. Meera for inviting us, the retired faculty, to speak today. We are really grateful for that, Meera. I start with the photos of the legends who were there when we were students in pathology department. The first is Dr. C.K. Job, about whom Dr. Susy has already spoken about. He was a legendary figure in the field of leprosy, well known all over the world. Then the next one is Dr. Bhakta Vijayam. She was the head of the department when I joined the department. She was a real, she was a cardiac pathologist, a very intelligent lady, and a domineering personality. So she would always sit, at the office desk table. And there was only one phone at that time in the department, one landline phone, and she would pick up all the phone calls that came. And if there was, if it was for a biopsy report and you were holding it for a deeper, you would be summoned there and you would get it tied from her. Why deeper? I can diagnose it without deepers. So that was Dr. Bhakta Vijayam. Also, she was so confident about her pathology that, when a frozen was sent by Dr. Fenn was a very aggressive surgeon in aggressive pathology, surgeon, who was the head of Department of Surgery at that time. He would send a thyroid frozen, and it will be a colloid-filled, circumscribed nodule. And she will say, tell him it's benign, I won't do the frozen. And you will be the junior lecturer standing there saying, so ma'am said she's not doing frozen. You would be the punching bag between both sides. So ultimately, of course, it had to be done because he sent it. Then is Dr. Date. Oh, the previous slide. I think you. Yeah. So Dr. Anand Date, brilliant person, one of the most intelligent people I have ever met in my life, actually. He was a nepropathologist and a very good undergraduate as well as postgraduate teacher. Dr. Sushil Chandy was the neuropathologist, and after his training in neuropathology in the Montreal Institute, he started this division of neuropathology within our department, which was later handed over to Dr. Geeta Chaku, who runs it very efficiently now. And then Dr. Minnie Martin, the gastrointestinal pathologist. She was a mentor to many of us in the department. And she was an excellent researcher and has published a lot of work in that field and has handed over the reins to Dr. Ansu Pulimud, who is, following her footsteps now. Next came Dr. Hemalata Krishnaswamy. Despite her various interests, including hematopathology and gynae pathology and cytology, she was always willing to see all our consultations, all our see and opine on all our difficult cases. And there was always a big queue outside her room to show cases, just like Dr. Noel Walter is for you now, I guess. And of course, Dr. Susy Kurian, my colleague, who was with me from when I joined the department till a few years before I left. And she was, known for her discipline and hard work and almost military-like discipline in the department. And some of it had rubbed on to us when we were there. So we were surrounded by these legends when we were in pathology department who practiced and propagated the principles and ideals this institution stood for. It's hard work, discipline, commitment, and honesty. I'd like to narrate an incident now which happened when I was there. When Dr. Sushil Chandy was head of the department, our biopsy rates were around 120 or 200 rupees per biopsy. So I once went up to him and said, "Sir, can we increase the rate of biopsies? That may help our special fund and all that." And he looked at me and said, "No, we are here to provide quality, affordable services, Sheila. We are not here to make profit for the institution." That was the sentiment of the department those days. So, this is a rare photograph of Dr. Anand Date taking the nephropathology class for undergraduates. And those days we had only blackboard teaching. There was no PowerPoint and all that. And those photographs of the glomeruli that he drew on the blackboard are still in our minds, the capillary wall and the mesangium. We'll never forget all that even now. He was that kind of a teacher. Now coming to the milestones in development of department, immunohistochemistry as a diagnostic modality was started in 1985 by Dr. Susy Kurian, who had just returning from her training at the Hammersmith in London. And initially it was manually done, and she was so meticulous about it that, the doctors, we had to go and put the antibodies and developing with DAB and all that. But thank God, soon the automated immunostainer was installed, the Ventana stainer, which was one of the best in the world. And we were very fortunate to be the first in South India to get that Ventana autostainer. The only other institute which had it in India was the GCRI in Gujarat. We were the second in the country to get it. Molecular pathology lab was started in 2006, and it has by Dr. Susanna Thomas, and it has grown in leaps and bounds since then under the supervision of Dr. Rekha and Dr. Geeta Chaku, about which Dr. Meera will talk about in detail. 2011, there was a major renovation of our department in Asha building. We rebuilt a part of it. We made the lab air conditioned. Earlier it was not air conditioned, And the temperature outside went up to 42 and 45. The temperature in the incubator was 37. So that the technicians used to come and ask us, should we keep the slides in the incubator or outside? The special stains wouldn't work, and we had a lot of problems with sections. So the administration headed by Dr. Suranjan was very kind to us and allowed us to air condition the lab at least. We had made divisions of it because they said they can't air condition the whole lab together. So it was divided into sections for air conditioning. So the thin prep technique was introduced for exfoliative cytology, and that made work so much easier for the technicians who had to screen some 90 cases of cytology from end to end. So that made it very much easier and more reliable as well. As far as MD training goes, we got some changes done in 2009 with the help of the university vice chancellor that time, Dr. Mail Vahanan, who was, one of those very proponents for radical change. And he wanted changes brought about in everything, including clinical subjects. And so with the help of other faculty from MMC and others, we got this biochemistry and microbiology removed from the syllabus of MD pathology. And that was very useful. It was quite superfluous, actually, to have microbiology and biochemistry when they had their own MD degrees. There was no need to go into that for pathology. Also in 2011, we increased the postgraduate seats from 2 to 8. That was a great relief for the postgraduates, who were alternate days grossing about 50 specimens every day. And so that was a great relief, though thesis always was an issue. We started fellowships in neuropathology and hematopathology in 2009. These were very busy clinical departments. So we had enough specimens, to teach, to provide comprehensive training for others in the country. So we had quite a few applications every year, and we were taking one candidate per year for a 2-year course. I think Dr. Meera has also started DermPath this year. So then 2011, we started the international CMEs. So one of our erstwhile clinical colleagues at that time told me that, if you want to showcase your department, you have to publish papers, you have to present at conferences, and you have to conduct CMEs. Only then you will be known to the rest of the country. So we started our bit by doing this international CMEs. The first was the CME on non-Hodgkin's lymphoma in January 2011. And we see quite a few eminent personalities. I can't point here. Okay. Okay. This is Dr. Yasu from Stanford, Dr. Rekha Nair from RCC Trivandrum, who later became the director also of RCC Trivandrum, Dr. Lisa Rimsa and Adam Bag, and Dr. Dennis O'Malley. Then we have a local national faculty, Dr. Anita Burgess and Sumit Gujral Basu. And the next one was the conference on breast pathology in 2012, again with national and international faculty. You have Dr. Stuart Snit here, Dr. Ashraf Khan from Mass General, Oops, going back. And Dr. Sangeeta Desai and Asavari Patel from TMH, Mumbai. The thyroid pathology CME was in 2013 February, where we had Dr. Anthony Gill and Ashraf Khan as the international faculty. Then we had Anita Burgess and Shubhada Kane from TMH, and Sudha Kini and Geeta Jairam and Dina Modi as the cytology faculty. They're great names in thyroid cytology. Following this, in 2014, after Dr. Bhanumati Ramakrishna took over, she held the Tamil Nadu and Pondicherry chapter of IAPM here. And she also held the liver CME. It was a hybrid event with both clinical as well as pathology. The Europe Pathology CME in 2017, organized by Dr. Ramani, and the annual Winter Symposium in 2018 by Dr. YV. In 2020, it was the COVID era. So Dr. Meera conducted the first virtual conference in dermatopathology in 2020. And 2023, the annual conference of Neuropathology Society of India was organized by Dr. Geeta Chakku. One of the major events that happened during my time here was the Asha grant in pathology, and in 2012, which was greatly helped by Dr. Joy Maman. I must mention his name. He was a young, brilliant pathologist who had just returned from his study leave and training in bioinformatics at the Henry Ford. And he provided a lot of input and advice and, on what to order and how to go about it. Not just the Asha grant, in many aspects of pathology, he would help us to sort out issues. So the main thrust was automation. So we got a lot of automated equipment like the automated slide stainer and cassette labeler, which helped a lot in decreasing the workload as well as faster turnaround time and avoiding mix-ups. All, automation is very essential in a high throughput laboratory. We got these Shandon workstations to have a formalin-free work environment. We try to provide standard reporting formats by the synoptic reporting software, which Dr. Joy got for us, and expedient reporting by this Dragon software. So that's the cassette labeler and slide labeler. We also got this ThinPrep integrated imaging system for screening cervical smears. It would automatically screen the smear and pick up the abnormal cells and keep that for the technician to see. The Thermo Shandon workstation. The Dragon voice recognition software, by which they could, dictate the reports, and we didn't need secretaries to type out reports. Then we got this synoptic reporting software. I'm not sure whether it was really, whether we continued using that. Not sure about that. So to conclude, I must say that there still are a lot of intelligent and dedicated pathologists in our department. I don't want to mention names. They're obviously there, and I'm sure they will maintain the standards and of this department and of this institution and keep the flag flying high. Thank you.
This is a special year in my relationship with pathology. I joined the institution as an undergraduate student in 1964. So that makes it 60 years of my association with the institution. And I joined as a postgraduate student in 1974, which is really the golden jubilee of my association with pathology. So I thought, okay, so let's do it one more time. Now, both Susy and Sheila have really in a very short time given you a wonderful overview of the growth of the department. In a sense, my tenure as faculty was a little more peripheral than theirs, because when I came back to join in 84, I was actually invited back to teach forensic medicine. Now, in those days, government medical colleges were permitted to do medico-legal postmortems, but not private medical colleges. So we didn't really have a full-fledged forensic medicine department, but in rotation, faculty of pathology would take the forensic classes. So I've had very illustrious predecessors. We were taught forensic medicine by Dr. Ramani Pulimud, and then by Dr. Adolf Walter. And then later it passed to Dr. Minnie Martin, and I took over from her. But because forensic medicine teaching was not a full-time job, the deal was that I would work in pathology and teach forensic medicine. And of course, it also ended up being teaching both pathology and forensic medicine. And that's a decision that I have not really regretted. So Dr. Noel and Dr. Maushmi have, of course, been instrumental in the final separation of forensic medicine into an independent department. Now, what I'm going to talk about is, you've heard about all the legends of pathology, all the big names that now feature in textbooks and international giants in many fields. But we had other teachers in the department who are not faculty members. And I really want to focus a little bit on them, because when we joined the department, these were people who shaped our lives in many different ways. As Susy said, when I joined pathology as a postgraduate, we were housed in the present OPD building on the 4th floor. And the office, or in fact, the whole department was really run by Mr. G.R. Vijayaraghavan, whom we affectionately call GRV. And he was assisted by Mrs. Saraswati Parnivelu. Now, we all called her Saras, with the exception of Dr. Walter, who would call her Mrs. Parnivelu. And my remembrance of Mr. Vijayaraghavan was that he was a perfectionist in his job. And please remember, this was the pre-computer era. And one of the big challenges was getting our postgraduate thesis typed. And the requirement was a 50-page thesis, and it had to be done on a typewriter. Those days, of course, luckily, we were only 2 postgraduates per year. So when our theses were ready, we would be invited to Mr. Vijayaraghavan's home in the evening after work. So both the exam-going postgraduates would set out with our stack of papers, and he had a typewriter in which he would type one original with 5 carbon copies. And we dictated the thesis, and he typed it, and he was a perfectionist. So if you stumbled on a word or he made a mistake, he would rip the paper out and we'd start again from the beginning. And we would sit there and sometimes till 9 o'clock at night, taking turns, the 2 of us, to get our thesis typed. So that was Mr. Vijayaraghavan. Saras was a more motherly figure, and I think she was the one we all went to when we had interpersonal problems, and she would help us sort it out. They were also assisted by Mr. Albert, a young man called Mr. Solomon, and I remember we all were marshaled by Dr. Bhaktivijayam to go to his wedding in the Central Church. That was another thing. We were all expected to attend all the social functions, personal functions of the staff, and Dr. Bhakta would take it on herself to make sure only the person who was who was doing the postmortem duty was allowed to stay back, and all the rest of us had to attend all these social functions. Now later, Mr. Ebenezer, whom most of you will know, took over. I'm not mentioning all the people who are still working, though I did work with some of them before I retired. The other set of characters whom I remember vividly are associated with the postmortem room. Postmortem room was situated where the Silver Gate is now, opposite the geriatrics OPD. The year I joined MD Path was the year of the big strike. And those days, we used to have a 24-hour postmortem service. So when there was a push especially to get postmortems on post-transplant patients who died, because we were just learning the pathology of complications of transplant. Many of them were from other cities, and there was a pressure on time to get them their transport to take the body home. So postmortems were done 24 hours. In the postmortem room, we had attenders to help us. And the one I want to talk about is Mr. Balasundaram, the tiny little man, and he would help us make the incision, and then he would peer into the abdomen and pronounce his diagnosis, which was usually right. So he'd look in and say, "Ella TB," or "Ella cancer." And 9 times out of 10, he was correct. In the lab, we had two very quiet gentlemen, Mr. Arthur and Mr. Peter. And they were assisted by Joseph, Mr. Amal Ryan, Lydia. The EM work was just starting, as Susy said, and the first technician there was Mr. Shantakumar Genius. The cytology lab was largely staffed by women. So we had Rachel, we had the senior lady was Ravi Rani, who left and went to the Gulf after some years. There was another Usha Rani, Mercy, and each of them had a special contribution that they made. Now, as I said, this was the pre-computerization era. So we had a medical illustration unit, and they would help us prepare graphs. They would also make pictures. And there we had people like Mr. Sitapati, Mr. Kesavan, Mr. Giri, and many of the illustrations were actually hand-drawn. They were really works of art. And I'm not sure how much the museum is used nowadays, but apart from the specimens which we had, there were also illustrations drawn by hand. And I think most of these have now been phased out by the computerization. We had the office attenders. We had Mr. Munusamy, and he had gave a special slant to all the names. So he would talk about Dr. Muniyama Mathan, Dr. Pulimote, and those names were rather catching, and that's how we referred to all these people after that. There's Mr. Gopal, and we had one lady attender called Anasuya, very small-made little lady, and it was terrible to see her wheeling the trolleys with the specimens from the theater, but she did it anyway. In those days, there were only 2 postgraduates per year, and I can't imagine a department with 8 postgraduates per year. So, and as Sheila remarked, the 1 year of the 3-year course was spent in the peripheral postings in biochemistry and microbiology. So in the department, we had 4 PGs, and we had a 4-week rotation: inside biopsies, outside biopsies, autopsies, and cytology. So taking leave was an issue. I remember I had to come and ask Dr. Job for leave because a friend was getting married. The parents were not taking part in the wedding. So the friends had organized this wedding. So it was going to be a registered wedding in the morning, and I was on postmortem duty. So after a lot of negotiation, I was given half a day's leave. And when we went to the wedding, we discovered that the registrar had got the date wrong, and they're allowed to get married after 30 days of registration. And this was the 30th day, so it was not technically after 30 days. So he decided that we'd go through this, but next day, everybody had to go back to the registrar's office and redo this. Now, unfortunately, I had signed as a witness. So I had to go back to Dr. Job and tell him, I need half a day's leave to go for my friend's wedding. And I remember him looking at me and saying, another one? So I said, no, the same one. And, it was a difficult explanation to give him, but I did it. And I remember him taking his glasses off and putting them down and looking at me. And after 5 minutes, he said, I don't think anybody could make up that story. So he said, I can't give you half a day's leave. You have 1 hour's permission to go to the registrar's office and sign. So I look at it as a bit of a luxury to have 8 postgraduate students where you can juggle your duties around. I think what I really feel about pathology department is that we dealt with smaller numbers, but everything was done manually. Everything was, the time taken to do things was much less. So when I look at the numbers now, my mind boggles with the way the department has grown. We have part of the automation in some ways when the computerization came in, a little bit of the shift in technology from doing things manually to doing them with machines. But I think what is important is that the approach and the attitude to work, as I see it, has not changed. And I hope that is something that will continue. I think working with automation, working with instruments and machinery has its own challenges. But I think as we make the transition, what is important is to retain our focus on our core values. And I think what I can recall being taught by all these legends whose pictures we have seen is the importance of integrity and the importance of teamwork. And I hope that is what will continue in the department. So again, thank you all for inviting me. It's always a pleasure to come back to the department. Thank you.
So you've heard from the doyens of pathology. We couldn't have Dr. Sushil Chandy here, unfortunately, because he couldn't travel so far. But you heard from the best that we had, Dr. Susy, Dr. Joyce, and Dr. Sheila, because there were some people which you would love to emulate, but you can never reach their standards. That's what the standards they kept. We used to have about 100 biopsies per day. Today it's about, like 2 days back, we have reached 61,000 number of biopsies. Cytology is 22,000, fish 181, and molecular is about 17,000. The numbers have gone up. The personnel remain the same, except we have got increased number of technicians, increased number of assistant professors and senior registrars. You've already seen the state-of-the-art grossing station that we have. We can also take pictures on the grossing image that we do. So we started with manual processing, and now we have 3 automated, completely automated tissue processors, manual microtomes to now fully automated microtomes with the water bath within it. Cover slipping is done completely automated in the Ranipet campus, not so in the main campus here. We have 3 automated IHC stainers in the main campus, and so same number in the Ranipet campus as well. Like you just heard Dr. Sheila tell you, we started with writing reports, then it went on to the computers, and now we can write it on our own using the Dragon software. We started with 1 microscope, then it became a double header, and now we use 10 headers for group sessions in both the campuses. We've also been accredited by the NABL for in 2019, and we have maintained that accreditation. So far, we have had them do a physical accreditation of ours just last year. We've also introduced on the molecular front the NGS panel test. We started functioning as 2 campuses in 2022, late by October, and all those specialties which moved to Ranipet campus have a corresponding pathologist to report their biopsies in Ranipet campus. We had the immunofluorescence laboratory in memory of Dr. Anand Date, dedicated in the Ranipet campus with funds raised by Dr. Sally Date for the laboratory, the immunofluorescence laboratory. It was during Dr. Geeta's time, we got the whole slide scanners. We have 3 scanners, one in the main campus and one in the Ranipet campus, where we can scan 160 slides. So if you look at this, if this is a workstation, you go into images, and then you put on the digital image, you get all the slides that have been scanned. And once you click on view image, this is what you see. And you can zoom in or zoom out. All the images that you have scanned can be seen as well. We do frozen immunofluorescence, immunohistochemistry, molecular pathology, including FISH and PCR in both the campuses. We have doctors who shift between campuses, so the percentage of time they spend in each campus is slightly different. To keep pace with the growing needs of the institution, we have expanded our FISH and molecular pathology services to about 30 different molecular tests and about 10 FISH tests. We have got 161 next-gen sequencing panel for in the molecular lab. Coming to teaching, we teach both allied health, nursing, undergraduates and postgraduates. Under the new NMC guidelines, we have incorporated case-based discussions, self-directed learning, horizontal alignment, different departments, and vertical integration. We do tests like you heard Dr. Sheila tell you on the e-learning website. That's what we do now instead of paper tests. And we do it on that particular day's topic. We also do both a formative and summative feedback. And we are quite glad to say that this time the students have told us a good to excellent feedback. That's what we've got this time. The department runs a postgraduate diploma course for histopathology for technologists. We have 4 fellowships in the department right now: dermatopathology, hematopathology, molecular pathology, and neuropathology. We have had many awards, recognitions, and papers. Many of our staff have won numerous awards, and the latest what we have right now is the ICMR recognized CMC Vellore, recognized it as the best diamond center for advanced molecular testing in lung and breast cancer. And I'm very proud to also say that our technologist, cytotechnologist, has got the first in the country in the cytotechnology exam that he did just very recently. You've just heard them refer to the museum that we have, which was set up by Dr. Gold. This is the museum as you see it physically. Now, if you go on to the intranet, you can go into departments, go into pathology virtual museum. You can click depending on alphabet or on topic and see all the specimens as is. All you need is to register yourself in the e-learning website with a password, and you can see all those specimens. It's not all work and no play. We do enjoy ourselves. We go out for retreats. We have events in the department and outside. This is one of our technologists who got the prize for best vegetable carving. We've had potluck breakfasts in the department where we had the green day, everybody wore green, and we had everybody bring in one dish of their own and one for somebody else. So it was great fun in the department. So this is some of the events which we've had getting together. So what's next? Introduction of online teaching using whole slide imaging, new DM courses, in-house equals programs, especially for missions, courses for pathology assistants. We already have studies going on for AI-related pathology models. I'd like to conclude with a quote from Philippians 1 verse 6. I'm sure of this, that he who began a good work in you will bring it to completion at the day of Jesus Christ. Thank you.